Hi, it's Dr. Lewis Clark in Kingwood, Texas. I want to talk to you today about the frontal lobe. In particular, I want to talk about the three things that the frontal lobe does that you're not aware of or happens unconsciously. And I want to talk about how this affects our brain's ability to work properly, how to control our moods, how to focus and concentrate, and even how to have normal and healthy sleep. So let's start with the first thing that happens. When the frontal lobe begins to lose its function, the first thing that happens is we have an increase in flexor tone. This is flexor muscles of the body, in particular the ones in the front of the neck. So when that happens, what you notice is you start to get a forward head syndrome. This is the first sign many times of the frontal lobe beginning to decrease or lose function. The second thing that happens is you have an increase of sympathetics. The frontal lobe dampens or inhibits your sympathetic or stress response. So with this, now you start seeing things like maybe blood pressure or heart rate's affected. Maybe you see that the person is they're getting sick more often because their immune system is decreased. In the office, we'll see things like their oxygen delivery is low. We'll see their pulse ox is low. We'll see their digestion's not good. And of course, they're not getting good brain flow to the brain, not getting good blood flow to the brain, and the brain must have oxygen to function normally. So the second thing you see in frontal lobe decrease is sympathetics begin to express themselves when you're not in a stressful situation. Very important, happens a lot. And the last thing is that the frontal lobe loses its ability to control the temporal lobe. The temporal lobe is the part of the brain that controls our emotions and controls things like memory. So what happens is now, instead of the frontal lobe reasoning a proper response and thinking about it, that you have a social outburst, or you have an emotional outburst, or a socially inappropriate thing happens. And it's because the temporal lobe now is in charge, because the frontal lobe has decreased in function. We see this happen a lot with ADD, ADHD, and autism spectrum disorder people. And we see it also with other patients that just have brain fog, but they're now suffering with also anxiety and maybe depression or insomnia. So if you have a brain-based problem and you want to find out if the frontal lobe is the problem, refer to my video on the 4 R's, how to correct it, or contact my office in Kingwood, Texas at 281-354-8330. Make an appointment and we'll find out for you. God bless. Look forward to seeing you then, and live life well.